We move on to the next topic, which is a destruction, because derm is not just about excision or removal or biopsy. We also have the destruction. So when we talk about destruction, they are also going to destroy the tissues, the morbid growths. They are going to destroy. What are the techniques? The physician can do a laser surgery, he can do an electrosurgery, he can do a cryotherapy, chemosurgery, or a surgical curettement. So in a laser surgery, via laser light rays, they are going to remove the morbid growths or the pathological manifestations. Next, it is electrosurgery by passing current. Thirdly, cryo meaning ice therapy. So liquid nitrogen is being applied to that particular morbid area and they are going to destroy the growth. Next is chemosurgery by the application of chemicals like trichoroacetic acid. And then curettement is a surgical curettement. With the aid of a curette, they are going to remove the pathological manifestation. Okay, is that clear? So these are the different methods of doing a destruction. Now, what are all the conditions that are treated with such a destruction is? You need to know. Very simple. First would be the benign lesions. Next, the malignant lesions. Next, there is something in between these two is the pre-malignant lesion. So, say for example, they are going to destroy a benign lesion which is a Wart. Say for example, I can report that as 17110. If there are like 20 warts, I will have to report as 17111, 17111. This is for a benign. Now, the physician is going to destroy a cancer on the patient's arm. In that case, I will have to go for a 17262 or 17282 depending on that. Okay. Next is we have something called as a vascular malformation, cutaneous vascular malformation like port wine stain or hemangioma. Here the removal is via square centimeter. So for those we have special codes. Okay. Now for, as we saw, malignancies. Okay. So there is something called pre-malignant lesion. So a lesion which has a tendency to become a malignant one. So that is a pre-malignant lesion. So the typical examples are actinic keratosis and solar keratosis. So these are the conditions where the patient usually comes for a destruction. These are pretty common services being rendered in the American people.